All right, Dr. we are live.
Hey guys, it's Dr. Emer, and we're here doing male facial sculpting today with one of our great patients who's once done some lip filler not too long ago. He literally almost had no lips for such a sculpted face, very small nose, very small lips, perfect chin. So we wanted to give him some volume that gives him some shaping of his lower face and some enhancement of his lips, because what did I tell you guys? Lips make the face pop. The thing is if you do that overly done look, it can make you look doll-like or feminine. We don't want that. So the thing I want to show you guys about his lips come in is the majority of his shaping comes from the Cupid's bow and from the center 2/3 of his lower lip. So what I want to do first is give a little bit of shaping to be fine. It's a little nervous, you guys. He's already done it before, but you always forget what lip is like. So I want to give him a little bit of shaping of the Cupid's bow first. So I'm going to do a little pinch, deep breath, just at the edge, very little. I'm just going to do like a subtle emit bit. We're using Jupiter Velour because it lasts longer for him. And I'm also going to shape just slightly, even though we don't do this a lot in men, it does give a little bit of shaping and lifting when somebody has a really small lip shape. So that kind of pulls it up. And then what we're going to do is do a pillar technique. Some people call this the Russian lip technique. We're going to go in and just do very subtle, fine strokes. Now he wants to extend his lip open a little bit wider, which is fine. You could do it slightly. I just don't want it to look feminine. So we're going to focus the majority in the middle. Okay.
And for those of you wondering what it looks like, I will leave a picture on screen right here, a before picture, so you guys can see while we are doing it.
And you guys can see we just extended it slightly to the edge. I'm going to fill a little bit into the pillow in the middle, just so it gets a slight bit. And take a look now at the upper. It's widened slightly and is enhanced on the Cupid's bow. I'm just getting a little more volume in the Cupid's bow. Not too much, good. 0.2, upper quadrant. Now we're gonna go lower quadrant, lower lips, and do just a subtle bit. Again, keeping it really more midline. It's doing great. Perfect. And then, because I like his lips having it more medial, we're gonna do a little angled. We call this a V. Linear V thread. So take a look at the side there. Just gonna switch my needle. For some reason this needle got a little dull faster than normal. And I don't want it to be painful. So you see now it's a little widened. Yeah, so look at that half. So stop right in the middle. You can draw a line. Look at that side. Look at this side. What does our viewer think? Very good, he loves it. Love it. And you can see the improvement. So now we're gonna go again to the lower, just a little. Again, I don't want to overdo it.
So what gauge needle are you using?
So 30 gauge, very small. I don't want people to be in a lot of pain. I know everyone gets so concerned for my clients. They either want to ask them out or they get very concerned.
Or they want to find out what exact settings and exact
they
things
want to know
that
the exactly. They're asking about everything exact. So let's take a look. So now you guys can see more of a keyhole. Take a look. It's starting to form. Show them that keyhole. Perfect. Looks great. It fits really well with his wider jawline and his projected chin. So now again, we're going to go right up, last little bit, to the Cupid's bow. Just a little to lift. And then again, we're going to do our Russian lip technique. Why anyone coined that term, but they did. And again, we're trying to keep it more superficial here. He does want a little wider, so I'm just going to go a little bit, not too much. Let's take a look. Perfect. A little bit more on the Cupid's bow in the center. He's doing really good. Everyone gets a little bit of a tear. I want to do a little bit into the belly, just to make it a little more of a pillowy look. And again, just a little bit more into this central area. close for a second. Just want to make sure it's even. Good. He's doing great for all the needle pokes. So you guys can see now, take a look. We're pretty close to being done. I like to just sit for a second, go on ice for a second. I just want to calm it down. Use your ice for 1 sec. So what questions are they asking, Jordan? Because I have a little bit left. I want to fine tune right now. Obviously, it's bigger when it's done, and then it goes down. Everyone seems to get nervous right when they get it. Then they love it.
We have someone calling him cute. We have someone asking our patient out again.
So there you go. See?
We have that. We have the needle. We have
take that down a second. Let's take a look.
people reacting just to what we're doing.
You see how, if you take a look here, when I press here, you see how his bellies of his lips come forward.
Someone said, I'd fly from Australia and risk getting corona to see you.
Love you guys. I have a lot of friends. My best friend's from Sydney, so love my Australians. So thank you. All right, let's do a little bit more here. I'm going to try and give him a little more lifting. In this
Saitan Josh, he said, Happy Tuesday, superstars.
Hey, Saitan Josh, check out our Moxify today. Oh my god, that's so good. Looks really good. Check out our Moxify today on IGTV. Alright. So I'm just fine tuning.
How long until the swelling is going to go down?
You know, I tell people 2 weeks is like the perfect timing, especially with all the needle pokes that we do. But probably like 72 hours. He'll ice a little bit today, although honestly, I think he's gonna like it how it is. All right, so let's show him, let's do an Emer reveal.
All right, let's
So
show
tell everybody what an Emer reveal is.
So guys, Emer reveal is we are going to hand the phone to our patient. Our patient is going to take the phone, we'll flip it on selfie mode, and we'll get his reaction.
Hold on, I'm gonna do one little pinch. I'm gonna push out the needle just on the Cupid's bow here. There you go. Good. Okay.
All right, guys, here we go. We're going to give the phone to our patient.
All right, ready? Take the phone. You look onto the phone yourself, at your lips. What do you think? He can't even talk, you guys. He's so stunned. He can't even talk.
I love it.
Zoom in a little bit so you can show everybody. So it's widened slightly, elevated more in the midline, and from the sides, when you look at the angle, turn a little bit. It doesn't look pouty. It fits perfectly with the nose, lip, chin ratio. Now take a look. It just makes his face look good. He can't even talk. It's okay if you drool. It's okay if you drool. So now show him the mirror. We'll give him back, and then we'll ask him swallow so you can actually talk for a second, because I want you to tell people what you wanted. What were you looking for?
More volume on the top and like kind of filling them out more.
Perfect.
They look great. I love it.
That's what he wanted. So a little bit more volume here to kind of make it poutier. A little bit more to the Cupid's bow, and I extended it slightly. I don't want to overdo it because this area is hard when you have that little turnover. If you start putting filler that pushes the lip forward rather than bringing it up, and that's what we call duck lip. No one wants that. So we just want to elevate, and I get a little extension, but this is his natural shaping. If you start doing kind of what everyone's doing, where they're doing all these deep pillars and really pushing the pillows forward, you're going to look like you have rubbery lips, and just doesn't look natural. So this is a more natural lip. Why don't you pan? What questions are they asking? You lay back and relax. You're good. And then are they asking anything else we need to answer, Jordan, or no?
They're asking you, they're saying, hey, that looks painful.
Zoom in so that you can
It
see
really
his
wasn't
lips.
that painful at all.
See, and he's ready to go out tonight. Doesn't even need jawline filler, which is great. Let's take a look. They're amazing.
That's great.
Yeah, they're great.
Thank you.
You can see from the lighting, you guys, there's a shadow that hits these two bellies right here. And there's an elevation at each Cupid's bow, but there's no filtral column because he's a male. We don't need it. It will look feminine. So that is it. It's male facial sculpting, lip pop is what we did today. Take care. All right, now you ice. Hang on, we're gonna put you on a red light. Be right back.
Thank you.
Looks really good.
Thank you.